This is Dr. Karen Thurrecht for Hildegarde Health and Culture. I'm talking today to Dr. Chris Vose, who is a midwife of very many years experience, as well as an author, an educator, and so many other things that the list would be just so long. Chris, I wanted to talk to you today about something that you're involved in at the moment. I wanted to talk to you about calm birthing. Can you please explain to us what calm birthing is?
Calm birthing is a system of birth preparation which has actually been designed based on the latest evidence and some good hard scientific research. It was designed by an Australian midwife, and he did that in collaboration with other professionals such as people who deal with emotional difficulties, obstetricians, other practitioners as well. It's a wonderful and powerful way of preparing for birth, and people are getting some remarkable results from it.
So what does calm birthing involve exactly?
Well, it involves couples coming and doing a particular course which is quite set and quite designed, almost like a workshop, and they actually really do enjoy it when they come, and they go home with the skills, abilities, knowledge and techniques to actually for their birth journey to develop the best birthing options for them.
And so, Chris, tell me, how is it different from traditional antenatal classes that they might have in a hospital?
Well, it's very different. For the first way it's very different is people pay for it privately. Now that means that the practitioner or the facilitator who's teaching calm birth is working for the couple. So there's no bias. They're actually giving a very balanced view, and they're meeting the couple's needs. Unfortunately, in some hospital type birth preparation classes, they tend to actually push the protocols and the ways that the hospital needs to
procedures
work,
within
the procedures within the institution, and that's okay. And I wouldn't stop people from going to that. I think that can be valuable in and of itself, so that you know what you're getting into and what they expect within the hospital. However, I think women are missing out a great deal if they don't enter into a private birth course which can actually help them to tailor-make their birth process and to come out with some very strong strategies to actually work with the process of birth.
So I'm understanding what you're saying. I'm wondering, what sort of birth is it that women want?
Well, it varies quite widely. I mean, some people actually want a caesarean for birth, and I think that's not every woman's right. You know, they're fairly safe now. They don't have so many effects on the baby, although they can have, and that's quite unfortunate when one of these effects happen. However, they're fairly safe. What I do regret though is I think women are making choices about having a caesarean, elective caesarean, without fully understanding the options and the possibilities open to them. You see, I actually was trained as a midwife many years ago, and I always thought birth had to be very painful, and because that's what I saw every day, and women expected that, and women came and they had very painful births, so that's how birth is or was for me. And I see many obstetricians and doctors believing this as well, because that's what they see every day. However, what first started me off on a different track was when I went to Sumatra, and I looked at some traditional birth attendants. I actually worked with them over a few weeks and looking at their practices, and I recognised that women were having these quite comfortable, easy, gentle births, and I thought, oh, they must have different pelvises or something. And no, it was that they actually didn't expect birth to be painful. So in this particular culture, in this particular village, it wasn't a painful event, and women would say, well, are you expecting pain? Is it supposed to be painful? And I thought, oh, well, I thought so. And of course that led me on to further research, and I realised that way back even in the 1930s there was some evidence to show from Western research that women could have comfortable births. And when I started to investigate it more, I realised there are three main mechanisms for creating birth pain, and that's what women are actually doing. So women, of course, if they think they're going to have this horrendously painful birth, they don't want to do it. But if they only knew that birth is designed to feel comfortable, it's designed to feel so good that the woman will come back again and again and again to have more babies. And that makes sense, doesn't it?
It does make sense.
Yeah,
wow,
yeah.
pain-free birth.
Yeah.
That sounds pretty amazing.
There is one danger with calm birth, and I think I must tell people who are tempted to think about calm birth, is people may plan to have 1 or 2 babies, but after experiencing a calm birth, they want even more. So once they've had, and I've seen it, I've seen women having babies and going, oh, I've got to do this again. And that's the big danger, because they may have planned just for 2 babies, but they go ahead and have more.
So, Chris, what are some of the strategies that women can use in a practical sense to prepare for a calm birth?
Well, first of all, they need to stop watching these dramatisations of birth on TV, because that's where we actually learn about birth. And that's certainly one of the sources that I learnt about birth when I was young. And anytime you see a birth on the TV, it's like, oh my God, experience. And of course it's about drama. The television, the films, they're about drama, and there's nothing dramatic or entertaining in a woman just sitting quietly or kneeling quietly in a corner in the dark, delivering a baby in peace and quiet. Okay. So we're learning that birth is, and that's going deep within by watching these dramatisations, which are just not realistic at all.
Okay, so I can stop watching dramatisations of birthing on TV. What else can I do?
Well, you can stop listening to those negative birth stories. So every time you're pregnant or every time you talk about birth, somebody has one of those birth stories. You know, the quite traumatic birth event. And of course these things do happen, and I can actually tell you the system and the way women will get pain, because it's very easy to get. And of course they want to debrief those births, and they need to debrief those births. However, you need to wait until after you've had your baby, so you're not influenced by those negative stories. Make your story and allow it to unfold as it will. Do the best with your birth. Get the better kind of feelings, you know, and do everything to prepare for that, rather than sort of really thinking it's going to be that way and being influenced by that.
Can we seek positive stories? Are there positive birth stories?
There certainly are. If you go on the net and on the web and do a Google search for positive birth stories, you're going to find lots and lots and lots. I've known women at birthing groups to come and to be debriefing about their birth, and the ones who have had these really ecstatic births, these calm, comfortable births, are a bit reluctant to share, because they don't want other women to feel bad. So I've actually said to women, you had a wonderful birth. Oh, she said, yeah, I don't want to talk about it, because the others had such negative, you know, and they didn't want to make them feel bad about it.
Yes.
So seek out those good birth stories, because there are so many, and I've seen so many now.
So I'm with you so far. We need to stop watching the dramatisations on TV. We need to seek out positive birth stories. Now, what about, Chris, when we get to the point of labour? It can be quite terrifying, can't it, at that point? What sort of strategies can we employ at that point to be able to experience a calm birth?
One of the things about creating pain in labour is when we tense our bodies up. So tensing a body up will actually produce pain. What that's doing is there's a mechanism for that, and it's actually the tension of the muscle is actually restricting the blood flow to that muscle. So it becomes, we call it an ischemic state. So there's a reduced blood supply, and of course the blood's carrying oxygen, so it's actually cramping because there's a reduced blood supply to it. And when women feel that, they tense up even more, resisting the contraction of the uterus. And that's the first mechanism that actually creates labour pain. The second mechanism is when they actually tensing, they tend to breathe in a very shallow and quick way, like this. of course, that shallow breathing doesn't get good oxygen exchange in the lungs, so we're actually getting a reduced oxygen supply to the blood. So we've now got restricted blood supply and a reduced oxygen in that blood that's getting there, so there's another way of creating ischemia, which causes cramping. And then the third thing is, once women feel this, their eyes shoot up and they get frightened, as you say, they can be very, very scared by this. And when we're in fear, we release adrenaline in our bodies. And adrenaline has this, it can be a wonderful thing if a bus is going to hit us, because we'll leap out of the way before we even think about it. And adrenaline does this because it works very instantly, it's very rapid, you get your heart beating. It actually redistributes. There's a preferential redistribution of blood away from the centre out your arms and legs, so you can run away or you can fight the danger. And there can be as much as 400% increase of blood supply to your arms and your legs, and that blood is coming from the centre here. So your uterus again is ischemic, because what little blood that's going there is actually, a lot of it's redistributed, and then finally the little bit that's there is very poor in oxygen.
So we focus on what we don't want,
yeah,
and that's what we get, and then we make it worse and worse.
Yes, that's exactly right. Yeah.
So, Chris, what sort of help can women look for, and families look for, to be able to learn this calm birthing technique?
Well, to do the calm birth, they need to do the calm birth course, which is a program, a very solid program, which will take you through all the steps. It gives you the knowledge, it gives you the skills and the techniques for applying in labour. And that's not just for the woman, but her partner as well. And it also gives you the tools to actually take away and to practice and practice and practice, so that you can become, it's almost second nature by the time somebody comes into labour. In fact, when they've done the course, women, there's a big turnaround from women coming quite frightened of labour to, I can't wait, bring it on. And it's wonderful to see. Of course. It doesn't mean that you're not going to have any challenges in labour. The majority of women, and the evidence is quite clear on this, will have a calm and comfortable birth with no need for pain relief. In fact, they will feel only pressure in their tummies when the contractions are coming, and they're like the waves of the ocean, and they can actually deal with them in such a way that makes them more and more comfortable, quite ecstatic. Some women will get a very ecstatic feeling. There are a small percentage of women who will need some help, and of course that's why we have the midwives and the doctors and the hospitals, and that's fine. Calm birth allows you to accept the help you need gracefully and with a good feeling, knowing that you need it. It's not just because you're frightened, but you have some medical need or some obstetric need there, you know. Some women will have a caesarean. Now, the rates for caesarean, the World Health Organization recommends about 14–15% is about the right amount of people who would need, so 15 women in 100 would need or ask for a caesarean. And they're the number of caesarean sections we should be doing. However, unfortunately, in the West, where it's nearer to 80% in some hospitals, the caesarean rates, and some obstetricians have even higher numbers than that. And I think if women are asking for them, that's fine. They're fairly safe. They used to be quite dangerous, but they're fairly safe now, and some women will choose an elective caesarean. The only thing that I regret with that is that I think some women are choosing it because they think birth is quite negative and quite painful. If only they knew the calm birth way, they may not choose a caesarean. So I want women to choose what's best for them.
Make an informed choice.
Of course, you know, I'm not... Calm birth is not about getting any particular kind of birth, it's about preparing for the best birth, the birth you want. Whether that's a natural birth or a birth with some intervention or a caesarean birth, whatever, it allows you to be empowered, knowledgeable and have the skills. And these skills that you people learn in the calm birth classes are lifelong skills that you have forever. So it's very beneficial.
So it sounds like calm birthing is very empowering for women.
Totally.
Chris, do you teach a calm birthing program yourself?
Yes, I do. I'm very keen on doing that. I do work as a clinical midwife, but on a part-time basis, and I actually have the opportunity to apply some of the calm birthing techniques to women who have perhaps not done any preparation. And only the other night I had somebody who came in to the hospital quite anxious, and she wanted an epidural, and the anaesthetist was quite delayed in getting there. It was stuck somewhere or in a theatre or something. And I said, well, let's do some calm breathing, let's do some relaxation for you, and some of the techniques I use, just until your epidural gets here. Well, she actually took to it like a duck to water, and people usually have to practice it, you know, but some people just get it like that. She just really wanted to do it, she really believed, and she just followed my instructions, picked up on the techniques, and she actually delivered without an epidural. She actually didn't want one then. She said, I didn't know birth could be like this. I didn't realise. She was astonished. And she was sitting in the shower and the head just appeared. And I said, just feel down there. She said, oh, there's my baby. And she just lifted her baby into her arms. You know, so she actually didn't want, so we had to send the anaesthetist away. He was very pleased. They're really good, you know.
Yeah. So how can women contact you if they'd like to find out about your calm birthing program?
Well, I actually work on the Gold Coast, so I run a class once a month, and it's over a full weekend, so people have to commit to coming for both days. And they just have to find me on www.calmbirthgold.com. Okay, but I would advise them to seek out any practitioner who's near to you. My classes get very full very quickly, but any other facilitator will deliver the same course. So I suppose it's just a different flavour. You get people with different experiences, so you just get a different flavour with the different practitioners. But I would highly recommend just do the Calm Birth course, whoever's offering it, you know, the one that's closest to you.
Thank you so much, Chris.
You're welcome. It's been a delight talking about this.